Let me ask you a question. If every time you turn the lights on in your house, sparks flew out of the sockets and there was a pretty big fire risk, what would you do? Would you A, avoid turning the lights on and just living in perpetual darkness? Or would you B, try and address the underlying issue, call out someone that's qualified to take a look at the system and hopefully fix the problem? Everybody, welcome back to the channel. Mark Green here from diabetesdietguide.com, bringing you a bunch of free information to help you get on top of your blood glucose levels and live healthier lives. If you haven't done so already, head over to the blog and check it out. Now, as you can tell from the intro there, today we are talking about why low carbohydrate diets aren't always the best treatment option for type 2 diabetes. And this is a video that I've wanted to make for a while, and usually when I make anything about low carbohydrate diets, unless I say they're the best thing since sliced bread, if you excuse the oxymoron there, I usually get a lot of backlash online. So stick with me on this, because I'm not saying low carbohydrate diets aren't a treatment option for type 2 diabetes, and it's actually something we use quite frequently for our type 2 patients. But hear me out and I'll explain why it's not actually my most preferred method when you actually lay it out all on the table. So let's jump right in and see what I've got to talk about. So as we saw in that original intro with the electricity and the sparks coming out the sockets, we've got two options here. We can A, avoid turning the lights on, i.e. avoid the problem, or we can B, fix the problem and be able to turn on the lights and actually live without the fear of a spontaneous fire breaking out. Now, this is very similar to the way type 2 diabetes tends to be treated and talked about on social media and in the mainstream media, because they say that to treat type 2 diabetes, what you need to do is cut out carbohydrates, particularly starchy food, and therefore you address the problem of hyperglycemia, which is high blood glucose levels, and thus treating the problem. But if you were to put the carbohydrates back in, you would then see the same problem. So essentially what we're doing is we're avoiding the problem, which is the equivalent of not turning on the lights. So my preferred approach is actually treating the underlying cause and dealing with the problem that way. So what is the underlying cause? In type 2 diabetes, patients develop something called insulin resistance, and this is caused by fat clogging up the organs and the cells of the body, which means the hormone insulin, which is released from the pancreas, which lowers blood glucose levels, can't work as well as it previously did. So you cannot control your glucose levels as well as you previously could before developing type 2 diabetes. As a result, you produce a lot more insulin and glucose levels start to rise. So you're becoming more metabolically unwell, which is why we need to give medications to a lot of patients to help them control their blood glucose levels. Now with this, these patients will run a high baseline glucose level. So if they woke up without any medication and tested their blood glucose levels, it will be higher than it should be. Then when they eat carbohydrate containing food, that is converted to glucose and thus blood glucose levels continue to go higher. Again, we treat this with both lifestyle and medication generally in practice. Now before I go any further, just another disclaimer here. One thing to also think about is when we say about low carbohydrate diets, we're assuming that patients are willing to do that. Often in my practice, I'm negotiating with patients about what's the best type of pie to eat. They will, they are set in their ways and they have eaten a certain way for their whole life. So then suddenly completely flip it on its head, even though I'd like them to, isn't always an option. So you have to work with them. So just keep that in mind. And it's another reason why blanket diets aren't used on the NHS, because what's the point if they're not going to follow it? You have to work with the person in front of you. Anyway, back to what I was saying. So as we can see then, the problem is with the body, not the carbohydrates. Now don't get me wrong, and I've blogged about this loads of times, so I'm not going to dwell on it too much, but you have good types of carbs and you have bad types of carbs. Bad types are like the refined processed ones, and the good types have a whole body of evidence to show that they are good for your health. And to pretend otherwise is completely biased, it's ignorant. That if you look at certain literature that supports certain points of view, like keto or high protein, and then you ignore the more robust and larger body of evidence, then exactly we are being biased. So we need to take everything into account, which is what we do as dietitians. So I'm not saying this approach is right and I'm not saying that approach is right, but actually when you weigh up the evidence, it does look like that kind of Mediterranean style diet has the most benefits, but it's not to say that the other options don't work at all. So what we're trying to do here then is reduce blood glucose levels. So we can either try and treat the underlying issue, or we can just avoid the foods that cause the hypoglycemia. Both are valid approaches. However, with avoiding the issue, if you want to put any of those foods back in, or you find it unsustainable, you've got a problem, because you're going to get the same results as you've always had before. Whereas if we start to think about, well, maybe rather than just avoiding the problem, we can start to try and address the underlying issue, which is caused by that fat in the body, and actually start to break down the liver fat, the pancreatic fat, and the fat surrounding the cells of the body. What we can do is start to resensitize the body to its insulin response. So now we're becoming more insulin sensitive. So how do we do that? Now, first thing, for most patients who have type 2 diabetes, excuse the frankness, are overweight or obese. So addressing that issue is step one. Step two is trying to get as active and as fit as possible. It's probably not news to you that if you are fitter, you're gonna have better health outcomes. And this applies to type 2 diabetes as well. In fact, even just one bout of exercise sensitizes your body to its insulin message. So the more you repeat that, the more insulin sensitive you become, and therefore the better your insulin works. It just so happens that exercise also has a bunch of other health benefits, and it helps to burn up calories. And if you're burning up calories, you're reducing your calorie intake or net calorie intake overall, and therefore it helps you to lose weight longer term. It also keeps the diet much more sustainable, because if you're burning up calories, what you can do is literally have a little bit of cake and eat it, or enjoy your diet a bit more, have a bit more flexibility, because you're burning up the calories, so you have more margin of error essentially. Whereas when you're inactive, you have to really be strict on the diet, which from experience, most people find very unsustainable. And really what we're looking at is long-term sustainability, long-term results. We're not looking for the crash diet, we're not looking for 6-month results, we're looking for long-term, because ultimately it's the long-term health that we're after. So that's what we want to achieve, long-term, good quality of life in the best health possible. One thing I always find very interesting is a lot of the social media posts and mainstream media posts about low carbohydrate diets and how the dietary guidelines are incorrect usually are in the context coming from a place of having type 2 diabetes. But there's a whole bunch of people that follow the guidelines to the letter, because the guidelines are massively misinterpreted, by the way, who don't go on to develop type 2 diabetes. So let's have a look at some people. So athletes, for example, they have a lot of carbohydrates for the most part. Now, of course, they're not relying on the refined types, they're having the healthier options. I've done so many videos on this, I'm not going to go into it. It's a different subject, but they have the right types of carbohydrates in the right amounts for them to help fuel their exercise. Now, I'm not implying that everyone needs to be an elite athlete, but we can start to work down the scale. So recreational exercisers, or even people that aren't exercising, still eat carbohydrates and remain in good health. Myself as an example, I eat quite a lot of carbohydrates, and yet at the time of filming, I'm 36 years old, with the beard, or just from general life wear and tear, or my son who doesn't sleep. I might look a bit older, who knows? I've had comments before. Looks like I'm getting on a bit. But point is, it's funny, isn't it, that we seem to only listen to the people that then develop the disease and then remanage it by then cutting out carbohydrates and say this is the only approach that works. But yet we don't listen to the people that have never developed it in the first place, who are following perhaps a healthier lifestyle compared to their counterpart who did develop it and then try and manage it. So it's just an interesting concept that I find, that when you're coming from a place of type 2 and then cutting out, say, carbohydrates and having a high fat approach and then saying this is the only way to do it and the dietary guidelines are incorrect, we're then ignoring, one, all the evidence that talks about and shows us through thousands, hundreds of thousands, millions of people that having the right types of carbohydrates and the right amounts is very beneficial to your health. And also ignoring the millions and millions of people that don't actually go on to develop these lifestyle related diseases, maintain normal body weights, despite the fact they are eating carbohydrates. So maybe just something to think about, that there's always two sides of the coin, and it's easy to get locked in the one way of thinking when actually there's always a few ways to look at it. And that's actually my approach. So I'm not saying that low carb or higher fat might not be an approach that works for you. And truth be told, if you're overweight and then actually you find something like keto works for you as long as it's safe, then I'd rather you did that and lost weight and got metabolically healthier than remaining really overweight or obese, which is going to be worse for your long-term health. So there's lots of ways of approaching it, but maybe just another way of thinking about it as well. So when I say low carbohydrate diets aren't always the best treatment option for type 2 diabetes, what I mean is, yes, we can use it as an option whilst people are making changes, and in fairness, I do that. So I will recommend at least that we reduce the amount of carbohydrates these patients are eating. But really, they can eat a healthy, balanced diet with starchy carbohydrates in the diet, even with the odd slip on sugar, just to make it a bit more sustainable, if it's part of an overall balanced diet that is helping them lose weight and get fit. Because if you're doing that, that's how you start to push the clock back on the progression of diabetes and actually start to find that it regresses. And in some people, can actually push it into remission. So in fact, even the type 2 diabetes remission studies. Now this is an extreme example and I wouldn't really recommend this for patients, but you know, sometimes they need extreme measures where they do the very low calorie diets, 800 calories a day for 3 to 5 months. And they found that by losing significant amount of weight, people were able to push their type 2 diabetes into remission. That diet is about 55 to 59% carbohydrates. And a large portion of that was sugar because they are drinks. But because it's low calorie and they're breaking up and shifting the fat in their internal organs, actually, despite that, they're still able to tolerate it and still achieve remission with their type 2 diabetes. So it's not so much about the macronutrients in a diet per se, it's more about the overall intake and how that's relating to what your body weight's doing and what your fitness is doing. And if you can master that and get back to a good baseline, then you can have these foods without worry that you're going to have hyperglycemia. Now, of course, if you're not going to change anything and you're not going to start getting active and you're not particularly interested in doing that kind of approach, then yes, absolutely, lower carb is the way forward. And to be honest, yes, you'll probably lose a little bit of weight and see slightly different results because obviously you're reducing a big food group. And actually it's an interesting point because people that say that they followed the guidelines and developed type 2 diabetes probably weren't actually following the guidelines, because the guidelines, if you follow them to the letter, will not lead you to being overweight. So we notoriously overeat carbohydrates and generally food, and we're not active enough in the UK and, to be honest, in the Western world. So by reducing back the carbohydrates, a low carbohydrate diet is probably actually just what we should all be eating, particularly in the context of how active we are as a nation. Anyway, that's another topic. So just something I wanted to talk about, guys, for lack of better expression, for the haters that I usually get who comment below. By all means, happy for the comments, happy for some debate, and happy to be directed to other resources and research articles. I do look into this quite a lot and it is my full-time job. So I've got a good grounding with it. But so I just ask you to make sure that you've considered exactly what I've said. I'm not saying that low carb doesn't have a place. I'm just saying there are other approaches where you can have a more balanced diet and it might not feel like such a slog. Anyway, I'll leave it there because I've got a feeling that this video is going to be dragging on. So remember, if you like the content, subscribe, like, really helps me out a lot, and also turn on the notifications so you know when we are posting. Or head over to diabetesdietguide.com, look at the blog. We've got a bunch of information for you to help you get on top of the glucose levels. So I will see you at the next video, guys. Thanks.